Hi everybody, this is Laurel Messer from snowy Denver, Colorado. I work at the Barbara Davis Center as a nurse scientist, and I'm founder of the Panther program. And our mission really is to make diabetes devices more accessible, both for the person living with diabetes as well as the healthcare professional. I'm so honored to be part of D-Data 2021. Hi everyone, this is Dr. Laurel Messer. I'm from the Barbara Davis Center in Denver, Colorado. And I'm also founder of the Panther program, whose tagline is closing the loop on diabetes technology education. So you can kind of see right there what I spend all my professional time thinking about. The title of my presentation today is Building Out Education and Support for Closed Loop Systems in Real Life. And I'm specifically talking toward providers and healthcare professionals today. These are my current disclosures. Just to give you a little background, I am a clinical nurse, a diabetes educator, who's been in the field for 17 years. And when I first walked onto the scene as a research nurse, I learned to use the CGMS Gold, which was one of the very first continuous glucose monitors, which lasted for 3 days. It was not waterproof, it was corded, and did not have real-time data available to the wearer. We've come a long way in 17 years. And I've had the privilege and fortune to work with nearly every device out there. The most recent one has been as an investigator on the Beta Bionics insulin-only bionic pancreas, otherwise known as the islet. So that is currently undergoing randomized clinical trials right now. And I've seen a lot of different technology in between as well. So my passion in general is to help both healthcare professionals and persons with diabetes better understand and implement diabetes technologies in order to improve life living with diabetes. And that's really what the Panther program tries to do too. This is just a snap of our website. So the Panther program is currently a website with resources that are available both for persons with diabetes and healthcare professionals. And we're also available for consulting work and development of various projects as well. So I encourage you to check this out. I'll give you the website at the end of our presentation today. So in order to first talk about how to better support healthcare professionals who are working with diabetes device users, the first question we need answered is, are clinicians ready? Are they engaging well with technology currently? A survey was published a few years ago that was done through the Type 1 Diabetes ExChange Clinic Network, and they asked providers and clinicians about their general attitudes toward diabetes technology, CGM specifically, perceptions of the time it took to work with persons using technology, keeping up with the technologies, and any barriers that they perceived for the device user themselves. What's interesting about this is that overall, clinicians clustered into three main profiles. You could call them diabetes device personalities. So on the left here were the overall results of this study. So 20% of the healthcare professional surveys felt ready to engage with diabetes technology. They felt they had positive attitudes toward the technologies themselves and perceived that the persons with diabetes using the technologies had low barriers. About 39% were not ready yet. They either had negative attitudes toward the diabetes technologies themselves, or they also felt intimidated, like they couldn't keep up with learning about all the diabetes technologies available. And the majority of individuals were in the middle. They were called the cautious personalities. These were individuals who perceived that they knew enough about devices, but they perceived a high level of barriers for the actual device user, and so they felt a little more tentative about prescribing devices. Now, what's interesting is when you break this up into different types of healthcare professionals, the answers change a little bit. So for the providers, the MDs and the advanced practice professionals, 31% felt ready to prescribe devices, to work with them, had positive attitudes, and perceived low barriers. The educators were different. So, of course, at the time, these were called certified diabetes educators. Currently, the field calls them certified diabetes care and education specialists. 51% of these educators did not feel ready yet. They had difficulty keeping up with the technologies and some negative attitudes toward it. Only 13% felt ready to engage. A separate survey done by the JDRF and Helmsley surveyed non-endocrinology providers. Why is this important? It's because 50% of adults with type 1 are seen in the primary care setting and not by endocrinologists. 90% of individuals with diabetes overall are managed in the primary care setting. When these providers were surveyed about their general, where do they learn about diabetes and how equipped do they feel to work with it, they reported they looked at 24 different sources for diabetes information, which tells you right there that there's no one source to learn about diabetes. They spent a full quarter of their annual continuing medical education on diabetes treatment updates. These are providers who see every diagnosis under the sun, 25% of the time learning more about diabetes. And even after all of this, they did not report feeling confident to initiate and manage diabetes devices. What did they recommend? They recommended that they need resources that were time sensitive, that were engaging and sticky in the moment, and were practical for use. And they had some ideas on how to do this. Make clinical decision support for providers, give them point of care information, and integrate something into their electronic health records so that they can use it efficiently. And this is where my definition of clinical tools come in. I do not think that providers need one more educational resource or webinar out there. What they need is a tool, which I define as a point of care, practical resource to facilitate expert care to diabetes device users by any clinician, regardless of prior device competency. So how can we do this? This is what I work on. The Panther Tools project I'm working on is looking to equip healthcare providers to better equip persons with diabetes using devices to improve glycemic control. Here's an example of a tool. When Control-IQ rolled out in this past year in 2020, we had several hundred individuals going onto this technology and an entire group of clinical providers who'd never seen it before. I'd seen it for years because we used it in research. We were able to equip our clinical team with information on how to best interact with new device users by providing them this tool. We called this one the initial follow-up tool. It has both system assessment information so that the provider can assess how well the system is being used, ways to look at their glycemic control and provide some decision support to improve it, and then some instructions on both how to adjust insulin doses and provide relevant and important education for that new diabetes device user. Here's another example of a clinical tool that we created, again for Control-IQ because it's the device of the moment, to interact in a clinical care setting. We call this the Clinic Control-IQ tool. And the idea is when a person with diabetes comes in for their follow-up visits, the provider can use this tool alongside the patient to come up with new strategies going forward. This includes information about how to prepare the report, do a system and glycemic use assessment, recommendations for how to adjust therapy or explore new behaviors, an electronic health record template to go into the medical record, and finally a person with diabetes facing summary. That's like an aftercare summary that includes important educational tips and ways to go forward with the device that perhaps that person had not thought of before. The things that make this different from other educational resources is that it can be integrated into the workflow as a fillable form, step-by-step assessment, holding the hand of the provider to give important behavioral education strategies and decision support, a way to integrate it into the healthcare record, and providing the person with diabetes an aftercare summary. My vision overall is that the diabetes device world gets more crowded. I want to see more devices out there so that persons with diabetes have more choices. That's a win for everyone. But for the clinician who's intimidated by that, I think there's an important message that we don't have to be experts in everything. If we can equip healthcare providers with the correct tools at the correct moment, they can give expert level care without having that knowledge before they walked into the clinical care appointment. I think it's important that these tools are developed in academia by people who work in routine clinical care as well, so they can provide that very frontline clinical expertise. I think industry has an important role in supporting these efforts and licensing them for use, as well as nonprofits and academic organizations, professional organizations that can amplify and disseminate these tools for their workforce as well. In closing, this is some of the other resources on our Panther program website, which, as I said, is both for persons with diabetes and healthcare professionals. Our most recent resource we dropped is this comparison tool right now for the 3 currently approved hybrid closed loop systems and one that is sitting before the Food and Drug Administration. So check this out and learn about some of the similarities and differences between devices. I want to thank you for your time today. This is our website and this is my email. If you are a clinician out there who's interested in doing some feasibility testing with our clinical tools, we are actively researching the qualities of these tools right now. Please reach out to me. I'll have you in our study. If you are industry and want us to help create a tool for a device that you have manufactured, please reach out to us as well. And if you are a nonprofit entity and want to help support tool development with the Panther program, please get in touch as well. This is a great conference. I am excited to be here with all of you virtually, and I hope we have a good day. Thank you so much.